Thank you, Mauri, and welcome to the Pacific Digital Health webinar series. I am Safia Noor, joining all the way from Kiribati. The first webinar series for 2025 is about the mSupply suite of products explained. I would also like to take this time to thank DFED for their continuous support in the Pacific. While we wait for a few more to join, I would also like to welcome each and every one of you. Thank you for your participation. Now, this is the upcoming events we have in our next webinar, which is the 7th one. We will be diving into tasking in Paya in Tamanu. This will be on the 10th of April. Please do have it in your calendar, and we are excited to see you then. What's the agenda for today? The sixth webinar, as I have shared, is about the mSupply suite of products. Now, we will have three presenters today who will be diving into three different topics. The first one is the mSupply suite, everything you need to know about our healthcare solutions. That will be by Louisa. And the second one would be Open mSupply in Action, a global digital good changing health supply chains by Richard and Craig. We have the third one, which is Conforma in the Pacific, Smarter Solutions for Shared Challenges by Jess. If you have any questions, please feel free to place them in the chat and we will get back to you at the end of the webinar. Now, I would like to take this time to welcome Louisa to start with the first topic, which is the mSupply suite, everything you need to know about our healthcare solutions. Welcome.
Thank you, Safia, and hello, everyone. I'd first like to thank DFET for supporting in development for all our products. So, hello, everyone. My name is Louisa, and I work for the mSupply Foundation as a DTech technical liaison. Just a disclaimer, I've been a bit sick, so please excuse me if I do need to cough. But anyway, so today we're going to do what I call a deep dive into the mSupply ecosystem to see how it comes alive and brings together the tools that we need to create smarter supply chains. So first off, let's start with an even bigger question. Why do we need an ecosystem instead of just one system? Well, managing medicines and medical supplies isn't as simple as tracking stock. It's about procuring the right products, storing and delivering it on time, and ensuring compliance and keeping everyone updated so that supply chains can run efficiently. When these processes aren't connected, things start to fall apart, and this can put patient care at risk. So now that we know why it exists, let's take a look at how it all started. In many healthcare supply chains, tracking medicines is a huge challenge. Stock would run out or expire, orders would take too long, and without real-time data, decision makers were left guessing. This led to wastage, delays, increased costs, and ultimately patients not getting the care they needed. To solve this, legacy mSupply and mobile mSupply was created to enable real-time tracking, automated procurement, and safer dispensing to help healthcare teams manage supply chains more effectively. A great example of this is in PNG. In 2013, the NDOH adopted mSupply to reform its pharmaceutical supply chain. Since then, it's expanded to over 500 stores, now with over 1,000 trained staff. This dramatically helped to improve medicine tracking, inventory management, and decision-making across the country. So after legacy mSupply, what's next? Well, we saw how legacy mSupply provided us with a strong foundation, but like any ecosystem, evolution is essential to keep up with the changing needs of healthcare supply chains. Challenges like high costs, tricky and inconsistent interfaces, and limited accessibility started to get in the way, making it clear that we needed something more cost-effective, flexible, and easier for everyone to use. So this is where Open mSupply comes in. We took everything that worked well in legacy and modernized it to be simpler, smarter, and more adaptable. Now, instead of juggling different systems for desktop and mobile, there's just one platform for all devices, so users only need to learn one system. It's also got a new, cleaner interface and easier navigation, making training and adoption much faster. Plus, its multi-user capability allows teams to collaborate on the same tasks in real time. And we've also just introduced our new and exciting customizable patient program modules, so organizations can tailor it to meet their needs. This feature has been introduced to support targeted health initiatives like HIV, family planning, and immunization programs to monitor patient treatment and still be able to track program inventory. So there's a lot more about Open mSupply I could talk to you about, but we'll have a session coming up next on it. Okay, so that's Open mSupply in a nutshell. And you can also see here, it started to branch out into patient programs for tracking and monitoring specialized patient treatments. So now let's see what's next. So far, we've seen we can use to help people manage stock effectively, but wouldn't it just be nice if that was all we had to worry about? Unfortunately, the reality is that we also need to make sure our medicine stays safe and effective all the way to when it's ready for patient use. And one critical piece of this is cold chain management. So that's where our mSupply cold chain solution comes in. It includes real-time monitoring from our own Bluetooth temperature sensors and from our Berlinger fridge tag integration, and with data syncing to Open mSupply and mSupply dashboards 24/7 and real-time breach alerts from Notify. This means you can always stay on top of it and ensure your vaccines are protected. Now let's take a look at Cooks. They've been using our cold chain temperatures monitors since 2021. And in one of the facilities, they noticed a fridge with unstable temperatures, sometimes going over 8 degrees, the upper safety limit, putting vaccines at risk. With our cold chain solution and Notify alerts, the team quickly identified the issue and found the answer of using stock as temperature buffers. And within just a few hours, the mSupply dashboard confirmed the temperature had stabilized. This success not only saved their stock, but also gave their team confidence in their monitoring system. They now use it to help support them with continuously meeting their cold chain accreditation standards. Okay, and there we have it, the first part of our ecosystem. And so far, we've talked about stock management and cold chain, but none of that works without efficient procurement. If medicines aren't ordered on time, or if there's no visibility on supplier pricing, then shortages, delays, and high costs unfortunately become inevitable. Many procurement processes also rely on paper forms, leading to errors, delays, and lack of transparency, making it hard for governments and donors to track spending and ensure fair pricing. So this is where Health Supply Hub comes in. It's a fully digital procurement platform that replaces slow manual processes with a streamlined, transparent system. Procurement teams can manage and evaluate bids in one place, while suppliers submit bids online, reducing paperwork and ensuring competitive pricing. With automated approvals and real-time tracking, stock levels match actual needs, preventing shortages and overspending. Plus, built-in insights give governments a clear view of procurement performance, improving accountability and efficiency at every step. Then we have the mSupply tender module, which works hand in hand with Health Supply Hub to make procurement even more efficient. It allows for transparency and cost effectiveness through line-by-line evaluations, automated supply notifications, and direct purchase order integration with mSupply. So what are some of the things we've managed to achieve with our procurement solutions? Let's have a quick look. In Timor-Leste, implementing the mSupply tender module led to a whopping $2 million saved on a $5 million budget through competitive bidding and greater supplier selection. Lead times reduced by 4 months, which meant a lot faster delivery of essential medicines. The secure online bid entry also prevented tampering, strengthening the whole procurement process. Then in one of our DTAC supported countries, they also managed to save $500,000 and improve medicine availability. In addition, 91% of the items were awarded to suppliers, reducing dependency and strengthening their supply chain. So how good is that? More savings, faster deliveries, and a stronger supply chain. At this point, the real question is, why wouldn't you want to use it? Okay, so now that covers procurement. Right now, we still rely on legacy for tender evaluation and purchase orders. But as we continue migrating to open mSupply, this will eventually all shift over, reducing the number of systems needed. Okay, so we've seen how better procurement leads to big savings and faster deliveries, but what about the quality of medicines entering the supply chain? Regulatory approvals are a major bottleneck here. Again, slow manual processes and lack of transparency make it easy for things like substandard or counterfeit medicines to slip through or for your deliveries to be held up at customs. But this is where Conforma comes in. Conforma is a solution that helps to streamline approvals and automates compliance tracking so that your medicines meet quality standards. But how does it fit into the ecosystem? Well, Conforma is built for interoperability, so it can easily integrate with systems like Health Supply Hub and Open mSupply, helping improve oversight and keeping the supply chain running smoothly. And there's a lot more to talk about with Conforma, but I'll save this one for our in-house expert who will present later on. And there we have it, the next piece of the puzzle. And hopefully one day we will have a link between Conforma and our other systems too. Okay, so we've now talked about procurement, stock management, and regulatory approvals, but all of these generate data, lots and lots and lots of data. And without the right tools, this data just sits there, unorganized, underutilized, and not really helping anyone. Ideally, we want the healthcare teams to have real-time visibility so that they can manage orders, track stock more efficiently, organize regulatory work with the ultimate aim of being able to make informed decisions. And that brings us to our mSupply dashboards. Instead of drowning in spreadsheets or waiting for outdated reports, teams get real-time interactive insights at their fingertips. They can see stock levels, usage trends, and any data they require instantly, helping them take action where it matters most. And the best part is that it's not just the number on a screen. Dashboards bring together data from facilities, programs, and procurement systems, giving everyone a clear view of what's happening in the supply chain. Okay, so we've seen dashboards make a huge impact in DTAC-supported countries too, helping teams track stock in real time, respond faster to shortages, strengthen cold chain monitoring, and even visualize workload trends to plan staffing needs more effectively. And here's where it fits into the picture, which is basically everywhere. So now we're starting to think like a real supply chain pro. So let's ask ourselves, what happens when something goes wrong? How do we know when action is needed? And how can we respond before it's too late? We need a way to stay ahead of supply chain risks, and that's where Notify comes in. Notify is all about speed and visibility. Instead of waiting for someone to notice a problem like stock shortage or cold chain breaches, Notify sends real-time alerts via email or Telegram, so teams can act immediately. It's also customizable, so facilities can prioritize the alerts that matter most to them, making things smoother, faster, and more proactive. For example, in PNG, healthcare teams struggled for tracking stock and responding to supply risks without real-time data. With Notify, they now get automated alerts on stock levels and orders, plus scheduled reports to track trends. This helps them act fast on shortages and plan ahead to prevent disruptions. And of course, this one also fits everywhere in the ecosystem. Okay, so now here's another thought. We have all these systems in place, and there's still lots of other systems out there, but they don't always speak the same language. Countries and organizations have their own ways of naming and coding medicines, making it hard to connect supply chains. But why is that important? Well, have you ever tried to build a piece of furniture with instructions that are in a different language or unclear? It's pretty hard. Imagine that, but on a global scale with supply chains. Without a common language, things get messy, orders get delayed, stock doesn't match up, and the whole system falls apart. With a universal way to classify medicines, systems can easily share data and place orders, which is what universal code does, and much more. Once local medicines are linked to universal codes, this will connect national codes like the WHO EML or ATC categories for you, allow you to team up with countries to improve procurement, whether it's through benchmark pricing or automated ordering. Plus, the Universal Codes database supports GTIN barcodes, which can make tracking and verification easy. And its inbuilt drug interaction feature means that new systems don't have to set it up from scratch, saving time and reducing errors. Now let's take a look at Tupaya. Tupaya is a powerful dashboard system from Beyond Essentials that collects and displays healthcare data. Some of this data, like stock on hand, comes from mSupply. And thanks to the universal code linkage, Tupaya can recognize that mSupply item and understand that it's the same item across different countries, even if they go by different names. This allows for better supply management, making it easier to track item data and ensure smoother coordination across countries. And there we have it, our core product suite. So now let's focus a bit more on this. So I just want to show you now how all of these solutions work across different environments. The key features here are sync and web-based access. These are essential to how our solutions operate, allowing them to function both online and offline. We can see here most of our products are available online through web apps, which can be hosted either by a cloud provider or directly by the country using them. But the real advantage here is that mSupply, OpenMSupply, and Cold Chain can all operate offline. This means they can keep functioning even without an internet connection and automatically sync once the internet is available, which means that our systems can keep running smoothly no matter what happens. And of course, like any ecosystem though, there's always a lot more going on beneath the surface that we don't see much of. So for now, let's take a quick look at the even bigger picture. Okay, so there we have it, the even bigger picture. The parts I've highlighted in yellow are more niche areas of the system that I haven't really dived into, but you might ask why. Well, the thing is, quite often every organization has its own unique workflows and needs, so it's important that we do have all of these different tools to accommodate for that. For example, some places might want to use barcode scanners for stock management or be able to print receipts. Some might need to order stock directly from a store, but don't have mSupply, so need to use the online customer module to do this. Someone else might want orders approved by other teams before they're allowed to be processed, which would require an authorization module. Again, there's never a one-size-fits-all, but here in our mSupply ecosystem, we've got the flexibility to meet all the different needs and make sure everything works smoothly for all the different situations. And speaking of that, it's time to look at how we can work with other systems out there that's not mSupply. Okay, but hey, now you might be wondering, why not just use mSupply since it looks like there's a whole ecosystem? Well, the thing is, sometimes replacing an entire system can be expensive, complicated, and just not practical. And other times, you probably like a particular system and don't really want that replaced. Of course, there can be many, many other reasons though. But this is where the problems come in. Without integration, there's no way for the systems to communicate with each other, and this causes workflows to fragment. Information starts to get siloed, which can lead to mistakes, like ordering the wrong stock or missing crucial patient information. Duplicate data entry and errors can occur, and it can also make it harder to get real-time updates, causing delays in everything from patient care to logistics. But when systems are integrated, data flows smoothly across departments, making everything way more efficient. Okay, so this slide is quite big, but it goes through some of our core integrations, but I'm not going to bore you with the details on how it works. I'm just going to give you a quick summary. So first, for DHIS2 integration, all you need to know for now is that mSupply syncs supply chain data with DHIS2, providing real-time updates and reducing manual reporting. Next, it can also help clinics using DHIS2 to submit stock requests to mSupply and receive shipments using the QR code generated by mSupply. And we talked about Tapaya earlier, so I won't go into that. And then finally, we also fully follow the HL7 fire standards to work smoothly with national EHR systems like Tamanu and Padded Plus to make sure that pharmacies have up-to-date patient records and medications are managed properly. And now here you can see where those specific integrations I just showed you fit into our ecosystem. Okay, so we're going to have to wrap it all up now. A bit sad, I know, but I think with every great story about an entire software ecosystem, there needs to be a good ending to it too. So I've thought of no better way to do that than to just give you the space to learn more about it. So here's our mSupply learning platform. For our legacy courses, we were using Talent LMS, and it's been quite successful actually. You can see we've had over 1,000 learners participate from over 74 countries, and a few of you might even be one of those people. They've also accumulated over 1 year of total learning time. How crazy is that? And of course, our great ecosystem continues to evolve over time, and this is just one of those exciting changes. So this is also just an announcement that we will be moving over to Moodle with a new learning platform that you can access at learn.msupply.foundation. But why move? Great question. We realized the current platform wasn't being able to fully meet everyone's needs anymore, so we wanted to provide a flexible, scalable, and user-friendly solution. And what does this mean? First, our new platform can provide multi-language support with tools like plugins or Google Translate, which will make it easier for learners all over the world to access courses in their own language, especially if translation resources are limited. Next, with offline capabilities, thanks to the Moodle app, our learners can also now complete courses anywhere, anytime, and on any device. And finally, we've started adding fresh new courses to the platform, so be sure to take some time today to check it out on our website link and find out more. And while we have just started our move onto this new platform, we are hoping to provide you all with lots more quality courses and content that will cover all these parts in the entire ecosystem. So what can I say? Sign up and stay tuned. And that's all from me. I hope you've learned a lot in this short amount of time. It was definitely a quick dive into our ecosystem, and I know there's bound to be lots more to explore. But for now, I'm going to pass you guys over to our next speakers. And if you have any questions, there's our email, so feel free to send those through. Thank you for listening.
Thank you, Louisa. That was a very comprehensive knowledge and very good to know so much. I hope all of you enjoyed that. Now we will dive into Open mSupply in Action, a global digital good changing health supply chains with Craig and Richard. Over to Craig. Thank you.
Good afternoon, good morning, everybody. So this very short session by me is triggered by the fact that Open mSupply has been accredited as a digital public good. So that could mean a lot or a little. So we're just going to unpack that briefly here. So firstly, in the simplest description of what a digital public good is, it needs to be free to use. Everybody can use it. It needs to be actually available to everybody, and it needs to be meeting a need of a society or something that's needed around the world. So that's Open mSupply, and we're very glad that it's been accredited as such. In the background, there's a more complex set of requirements, such as having a sustainable model, having good governance structures, and these kinds of things that make sure that it's not just a flash in the pan, but something that actually is built to last. Thank you. Next slide, please. So one of the things you get with Open mSupply is that we continue to have new countries approach us and ask us to use it. So we now have mSupply used in over 40 countries. And as we transition everybody over to Open mSupply, one of the advantages of being widely used is that you get to share both the costs of development. So this especially applies to small countries where you shouldn't have to, or it's not feasible to have to shoulder the costs of developing a complex system. As Louisa showed you, it's got very complex and very broad in its capabilities. And secondly, you also get to share the benefits so that when we develop a feature for one country, it's available for everybody and no cost to everybody else to use it. Thank you. Next slide. We're actually having a bit of a tied in with thinking about digital public goods. We're having a bit of a change in emphasis for the mSupply Foundation. So we're trying to, we're summing that up in a single word, effectiveness. And the idea is that at the start, we were focused on producing good software. And we're really trying to say that you need to be able to take that software and actually know that it's worth using it. So just to break that down a little bit more, we can see in the next slide. Thank you. One of the ways to ask is something effectiveness is to say, what are all the costs associated with a system and how does that compare to what the system provides you? So in our ideal world, on the what it provides side, you get things like improved start from the top, reduced wastage, and especially by reduced expired medicines. You get improved visibility, so your management of resources and stock improves. You have better procurement, so you, as Louisa gave two examples of where that can save a lot of resources that can then be applied to your health system to make it better overall. And lastly, if we can get medicines where they're needed, you improve patient outcomes. And that's what we're all really aiming for at the end of the day. Now, on the cost side, in some ways, this is almost saying that being a digital public good is only a very small part of the picture, because built into using a digital system, it's far more than just buying or being given a piece of software. There's also the training, the wages, the hardware, managing the system, travel to sites every time you need to make a site visit, having internet, and beyond just buying hardware, that hardware needs to be maintained and occasionally replaced. And also somehow you've got to provide a support system for countries. So how you balance these things is we're trying to work with several organizations to actually really be able to quantify both what it costs and what the benefits are, so that we can get a clearer picture and work on maximizing the benefits and minimizing those costs. Thank you. Now, this is actually an example from Papua New Guinea, and some of the work we've done there, trying to map out some of the costs. And I thought I'd just put this here because what's really interesting is in this projection, the software is only about 7% of the total cost of running a system. So actually, a lot of the other things around running a health supply chain have a far bigger effect on the total cost than the cost of the software. So part of what we're doing is trying to work on how we ensure that we don't just make a software system, but we make the deployment, the training, the support as sustainable and as low a cost as possible. So a lot of that is working on a system where we can empower you as the countries to take over as many of these responsibilities as you are both wanting to and capable of doing, and yet you get a really strong backup from us. So that's a little bit about digital public goods and how we're thinking about it at the moment. Thank you. I'll pass over to Richard.
Hi everyone. Thank you, Craig. So yes, I'm Richard. I'm a project manager for the mSupply Foundation, and today I would like to show you what is digital public good in action, so in the field, and I'd like to show you the specific case of Djibouti. So next slide, please. So Djibouti is a small nation on the east of Africa, a little francophone countries that we have started working with since 2022, with a pilot phase funded by the Global Fund, to basically install an eLMI solution such as mSupply for the malaria, HIV, and TB products there. Since then we've gone a long ways because other donors have joined the party, and now we have UNFPA for the family planning product, Gavi for the vaccines, and the World Bank for the essential medicines that are collectively funding the project to help the country manage their health supply chain. So the main beneficiaries in Djibouti are obviously the Djibouti MOH and the Central Medical Store, who are actually leading the project from an operational point of view. A little bit more about the scope of the project. So we're talking here about the national rollout of mSupply for all health commodities, including vaccines, and integration with DHIS2 and interoperability with SAGE, which is the ERP used at the Central Medical Store here in Djibouti. Basically coming back to what Louisa said about the ecosystem, Djibouti is actually a good example of this because, as you can see, we are using mSupply as the main component, but then we are plugging the system with existing digital solutions such as DHIS2, which is quite an important software for the Djibouti MOH, since all the data, and not just logistic data, but also epidemiologic data, demographic data are being aggregated into that dashboard. And so what we've done there is that we are pushing data on a monthly basis, a series of logistics indicators to basically eliminate the need for manual entry. So that has been quite appreciated. The other bit was the SAGE ERP that is used to run the Central Medical Store. So as some of you may know, mSupply is perfectly suitable to run a warehouse. But in this case, we're not here to change anything or to replace something that is working. Especially SAGE is having accounting capabilities that mSupply doesn't have at the moment. So it was perfectly fine for us to keep it there and to build that integration, allowing orders from mSupply to be automatically written into SAGE and to pull delivery note from the system. Even though the Central Medical Store is not using mSupply, they really saw the benefits of it. Obviously, reducing the need for paper orders, but also having that visibility throughout the system. So we're really looking into now the CAM CMS having visibility over the stock of their direct customers. So being able to quantify their needs, having a good idea of their available stock. And they do have also a series of pharmacies that they are supervising directly. So that's been really useful to them. And obviously the benefits for the others of facilities, regional warehouses, health facilities, is now having a system to manage their stock on a daily basis to ensure that they are keeping the right amount of stock and ordering based on their average monthly consumption. I put a few pictures of Djibouti because I promised them that every time I got the chance to promote the country, I would do. So Whale Shark, Lake Hassal, which is the biggest salt lake in the world. So just a friendly wink to them. Next slide, please. And so now, basically, linking back to the digital public goods. So it's really important to us to make sure that the country can own the system but also can become super users or system administrator without being dependent on external organizations such as the mSupply Foundation. And that's not something that we do just to look good. We actually are convinced that this is the only way we can have a successful project with a strong national expertise and ownership. And it has obviously other benefits, such as reducing the overall cost of technical assistance from organizations like ours. But this is for the sustainability of any project, this is capital to have a strong team. And there's also another point where once upskilled, local super users are just the best people to carry on the work. There's cannot be anyone better than them because of the culture, the language that they share with the end users, and obviously their deep knowledge of the local health system and the way it works. And where we are super proud now is that we're starting to see the beginning of a community of open mSupply users in Africa, especially in Francophone Africa, having a regional, possibly even international reach to promote South-South cooperation. And recently, one of the Djibouti super users have been invited to participate to open mSupply deployment in another country, in the Comoros. And that's something we're super proud of because that's, again, something we really want to encourage. And so super users is here. His name is Mohamed, and he's great. And he's been building a team that you can see as well below. And funny fact, we actually brought one of our new recruits to the latest trip in Djibouti, and the super users in Djibouti were actually the one training our own recruits. So just to tell you how good they are. Next slide, please. And yeah, just a shout out to finish my part about all the other super users, including many in the Pacific. So thank you for contributing to this amazing project that is the Open mSupply. And hopefully we'll keep working towards improving health supply chain. Thank you very much. Over to you, Jess.
Thank you, Craig and Richard. Thank you so much for the information. Now we will have Jess sharing knowledge on the third topic, which is Conforma in the Pacific, smarter solutions for shared challenges. Over to you, Jess.
Thanks, Safia. And just reiterating what Richard has said, definitely we know that there are a lot of super users and really great people taking leadership in the space of using mSupply and our other digital systems in our region. So I'm very much looking forward to what the future holds for the Pacific region. So today, what will I be talking about? I'm going to be talking about Conforma, but I'm going to bring it and try and talk about how it can help address some of the shared challenges our countries in the region are facing. So in particular, I'm going to focus on regulatory challenges. There are lots of different potential areas Conforma can help with, but it's actually designed to help improve regulatory and quality assurance systems. So in basic terms, creating basic processes to make sure the products that arrive to our countries are good, safe, and effective. So what are some of the common challenges we know that are in the region when it comes to medicines regulation and having good quality products? Well, we know that there are lots of different fragmented approaches. So in simple terms, all of our countries often do things in a slightly different way. This means it can be hard for suppliers who have to submit this information for you on regulatory information to know exactly what information to have on hand and what to send. It also means that sometimes we're assessing duplicative information. So country X is looking at the same manufacturer and product information as another neighbouring country. So that's one of the shared challenges. We know the other one is resource constraints. In the Pacific, it's very well known. You are all very hardworking and have many hats that you're wearing. Complex regulatory work is complex and it can be very time intensive. So this is definitely a constraint, having small teams managing not only their supply chains, but often also regulatory work as well. Another key one is a lot of the applications we receive for things like product pre-qualification or import control for quality assessments is often based on manual and paper-based systems. These can often mean slower processing times, increase your manual work, having to do a lot of data entry into our systems, and of course, increase the potential for error, or just meaning that we don't actually look at the data that we need to make sure the products are safe and effective when they're coming in. The next big one is definitely lack of data visibility. So once we've received that paper and we've started to assess whether a supplier in the products that they're offering and sending to us are of sufficient quality, what do we do with that information afterwards? Right now, it's often very hard to track this information long term to see trends for products or different suppliers, or even be able to pull up data from a particular procurement to see if the information from last year we can find again. As I mentioned before, import and quality control issues are sort of really key for our region. We really have a need to make sure that the products that we're bringing in to the countries are really good quality. There is known issues in the region for substandard medical products, which means that when the product is received by the actual patient and taken, it may not be as effective and as safe as it should be. So we do need to have a better oversight of this. This can come from having more urgent orders to suppliers that may not have submitted the correct documentations or knowing where a product has been approved from. The last big one is something we've all talked about in this space quite a lot, is that we would all like to have better regional collaboration, but there is a lot of barriers to getting this moving. One of the big ones is not having unified systems or abilities to share work or data really easily. And as I mentioned, there is a lot of duplication and inefficiency in the way we're working in a region. We are often procuring very similar products from very, very similar suppliers. So from that, what will I be talking about? I'm going to talk about, Louisa mentioned it today, our Conforma system, which was developed by the support of funding through the Department of Foreign Affairs and Trade. It's a regulatory management system that's designed to be an open source web-based system that can manage all of your different regulatory or application work processes in one place. It is open source, which means it is license free, and it can be used for a regulatory agency, or it could be used for a different type of organisation, such as a Ministry of Health or Border Control. There's no need to lock it down to if your country doesn't have a regulatory agency. It can be designed and fit to support you as well. So learning a little bit more about Conforma, what does it actually do? And what is a regulatory information management system? In simple terms, it allows you to digitize your applications to allow for people who are externally needing to provide you information to easily submit and have good quality applications. It also allows you to manage the approval and tracking of that process. So for example, if there might be a personal importation process for your country, where people who are bringing in a medicine from overseas need to submit some information on the prescription. This is something that could be automated in Conforma to make sure they're submitting the correct information at the time, and you're able to issue them an automatic approval and send out a letter without having to do all the manual processing work. It does automate the workflow, so it can take out a lot of the complexity in our processes. You can build set processes that can be very simple, from a one-step approval to having multiple people in the approval chain. You can also do things like having automated approvals based on certain conditions. So if a product is already registered in country X and has been maybe checked by a trusted country regulator, we could say that that one meets automatic approval, so we don't need to look at that. The next one it does is it automates all of our reports and databases and does all of that filing and removes the need for data entry, which just means that you have more time to actually do your work and make sure you're able to do more with the information on hand with the products being in country. It allows then, for example, if there's a product recall situation, we've had a safety alert, to easily look up to see the information about that product and whether you have it in country. Most importantly, though, although it's designed to have base workflows to allow for shared information and shared processes that have consistent harmonized information, it can be easily adapted and customized for any specific country. So we know that small countries are definitely going to have different needs to larger countries. Even within the region, there's big differences. So it can be easily customized without development. And it can be changed long term. Now, we've talked about applications and processes, but in reality, what kind of processes am I actually talking about? It could be something as simple as a product registration request. So you might have a requirement in country for product registration or pre-qualification of products as part of procurement processes, where you could also have potentially pharmacovigilance workflows, such as tracking and submission of adverse drug reports or safety signals monitoring. In an optimal world, you could connect with mSupply and have the supply chain batch data systems also flowing into Conforma and the two systems talking. It can do things like licensing and permits. Some countries have issue permits for controlled drugs before they're imported in, or also licensing of your pharmacy or wholesaler establishments in country. Really, also, it can be almost anything we think of that your team might be doing. One common example is the registration of health professionals. So I've got up on the screen here an example of a form and process for a medical board registration. And that means that we can digitize this and remove complex renewal pathways where people have to submit lots of manual paper forms and making that a simpler process in the future. So although we're talking about often medicines registration, it really can be any of those processes which we consider regulatory or the need to submit information and make a decision on it. All right, so the last little bit just about the system. As Louisa mentioned, Conforma is designed to integrate with mSupply and reporting dashboards. Right now, no country in the region is currently utilising it with mSupply, but we hope in the future having regulatory information linked with our supply chain can mean that we can have really good, solid, connected information from our regulatory teams and procurement teams all the way down to the last mile facilities to make sure we know that the products that are being checked and received are the ones that are actually being given to patients. And of course, we also integrate with our Grafana dashboard reporting as well for more specific things, such as maybe we want to know how many suppliers bring in antimicrobial products into the region. So taking all that back, now we've learned a little bit more about the system and we have already talked about some of these challenges. Let's just have a think about how Conforma can actually help with some of these challenges. So the first one that comes to mind to me is implementing standardized workflows within the region. And even on a country basis, if we have a process that's always the same, it means that suppliers know what information to submit and there's no ifs or buts or confusion around processes. So even having in-country standardization means it can become a more efficient and very clear process. But within the region, we can also begin to share the standardization of these processes. So just an example, Fiji is currently using Conforma for pre-qualification of medical products. Potentially, if another country is also doing this process, we can see what information is being submitted in the Conforma Fiji system and make sure countries are aligning to the terminology and types of documents being requested so that the suppliers don't get so much confusion with countries wanting such different things. We can also, as I mentioned, we've designed Conforma to be an all-in-one system that tries to automate and make things as simple as possible for reviewing. So this really does reduce a lot of the administrative work, a lot of the data checking work, and really is designed to support small teams with such a feature such as like having an automatic renewal of potentially a product where there's been no issues in the past 12 months. You could have an automatic renewal of the pre-qualification status. So we can build things in to mean less work for your teams in the future. The biggest advantage, of course, as I mentioned, is reducing manual complex processes that require often paperwork to be shipped, checked, scanned, and filed away, as well as having to do big emails and assessments and having all the data stored in different places. So having it all in one, where the same place that the applications are submitted is the same place that staff from the Ministries of Health can review that information and is also stored. So it's an all-in-one system. The next one is it helps to improve data quality by having a digital system that builds in set lists for things such as ingredient names or dosage forms or even manufacturer locations. It means that the bad data that we often get from manual paper forms or sometimes in our procurement requests where they might submit information that's a little bit unclear, it removes the ambiguity. So what we can do is have less time chasing up whether the data is correct and let the system do this for us using validation rules and set lists for suppliers to choose from. So the biggest thing, though, I wanted to mention is that the way Conforma has been designed is that it really can be used to support any mode of regional collaboration that countries in the region would like. To be more clear, every country could use Conforma individually and have their own portal to manage their regulatory processes. We could also have a shared portal where countries have different logins and the ability to do joint assessments or joint management or just shared information for quality medicines quality in the region. We can also have a combination of both, where we can have a centralized regional platform for some things and individual country portals for their own particular country-specific processes. So the options are endless. It's just thinking what's next and how we can move forward in the region. Now, I just wanted to quickly mention, I know we're going a little bit longer today, so I'll just speed up, but just wanted to mention the case study of how Conforma is being used by a real-life team in the region. So we have the lovely Fiji MRA team here, who's been using Conforma since 2023. So on the left here, we can see the Conforma portal is for Fiji. It's called the Fiji MRA Online Services Portal. And so it's all customized and designed. It's a national portal. As being an open source system, it's owned completely by the Fiji government. And so as such, all the data belongs to the MRA. And they're able to brand with their own logos and customize as they wish. They're currently using it for registration, provisional registration of products that are being brought into the country, pre-qualification of products for government procurement. So, and that can include manufacturer and product information, as well as for import permits for controlled and industrial chemicals coming into the country. In the future, and there's current plans to expand usage of Conforma to manage the other activities the MRA uses. They have seen the benefit of removing manual paper-based forms where previously for import permits, the importers had to physically come into Suva, hand over the importation paperwork, even if they lived in Nandi, and get it stamped before an import permit could be issued. Now it's all done digitally, and they no longer have to make the trip into the MRA office. So they've definitely seen the benefit, and they're hoping in the future to expand the import permits for all medicines coming into Fiji. Also potentially to automate the registration of pharmacists, and maybe also an export permit, because some products from Fiji are exported to our neighbours in the Pacific, so some of your countries as well. A little bit more about some of the success they've had. So before Conforma, there was a lot of manual or paper-based processes, as I've mentioned. There was a lot more inefficiency or slowness in how we could improve things, and also a lot of limited data for sharing. One key example is the time taken for manufacturer pre-qualification post-implementation, pre-implementation of Conforma was more than 2 months to assess all the information suppliers brought through. Once we have implemented the digital process in Conforma, the whole thing took only 2 weeks to assess more than 480 manufacturer submissions. That's a big improvement in efficiency. They also really found, importantly, it was hard to implement new processes. They were already so busy with their day-to-day work that just thinking of how they could possibly implement the new procedure of provisional medicines registration system seemed really hard to do. By having the system, they were able to launch and automate the submission process from suppliers, as also streamline the approval process based on products from Australia and New Zealand being granted automatic approval for the provisional medicines register. So they didn't have to assess that information. As I mentioned, they have a lot more efficient processing now of the import permits. Now it's all digital, and that people don't have to visit the office. And they have a lot more data on just the products that are coming into Fiji in general, which hopefully they'll be also able to share with their neighbouring countries and provide information to other countries in the region. Fiji is one of our only countries that has an MRA office, so they've shown a willingness to share information with other countries upon request. And as I mentioned, they also were able to digitize their existing pre-qualification procedures for manufacturer pre-qualification, and for the first time implement more of a product-based pre-qualification system, which prior to the implementation of Conforma wasn't possible. Really excitingly, they have more than 5,300 applications submitted for the provisional medicines register. At this time, when I created the slides, I was wrong. Actually, all of them have been currently processed, so there's no outstanding applications. So that's really amazing. And from what they thought was only 2 chemical import permits a month, the system routinely sees more than 15 to 20 a month, showing they were underestimating the actual number of import permits that they were receiving and underestimating how much work they were doing. So by using Conforma, they were able to see how much work they were actually doing and sort of talk to management to explain that's actually quite a big part of their job. I have a really short video just to share from the Fiji MRA team. And this is just a video that was used to launch the provisional register in Fiji back in 2023. So it just goes to show the goal of the Fiji MRA is to ensure that medicinal products such as medicines are acceptably safe and of good quality when they come to Fiji. They chose to set up a provisional medicines register to collect information from private suppliers about the medicines that they were bringing into the country. So all companies in Fiji that import medicines into the country are required to list all of their medical products in the register. This allows the Fiji MRA to know more what's happening in the country, understand what's being brought in, and also build a database of the different types of products and types of where they're coming from. So it was this video was designed to also help suppliers understand their requirements in this process, and that it's a two-way process of both the country assessing information and suppliers taking a step to start submitting it digitally. All of this was in the goal of improving healthcare in Fiji and taking the really good step forward into implementing a whole new process and making it more efficient, hopefully, for staff in the future. All right, my last little slide. So just some future thoughts that have been percolating in my brain. Just thinking about some of our shared challenges that we know that are in the region. It's very hard to do medicines regulation efficiently for our countries. So how could we use Conforma in the future to better support and share the work burden and also remove some of the challenges that we've talked about? Well, one potential way could be supporting more Pacific Island countries with a digital regulatory solution. That could be just to digitize existing work that takes up a lot of your time and try and make it less of a work burden to allow for focusing on more, potentially new processes to better monitor the quality of products that are coming in. It can also just by starting to build even just 1 or 2 countries can work to harmonizing the requirements and information we're requesting from suppliers and importers. And this would just allow also for better regional collaboration and data sharing. If we're all using the same terminology about the products that we're bringing in, there should be no stress when we're able to answer questions from other countries and make sure we're talking about the same thing. The last one is more thinking about the potential for using the system as a shared platform. As a regulatory system, knowing that maybe not all countries will be able to resource particular regulatory staff or processes, and that maybe we could build a shared ecosystem for a more stronger and resilient Pacific when it comes to having good quality and safe, effective medicines. So I think that's all from me for this one. Just some things to think about, and hopefully an explanation of how the Conforma tool can help with that.
So thank you again to Jess, Louise, Richard, and Craig for enlightening us with the amazing knowledge and all the products which are part of the mSupply suite. Please reach out to us on the BS support email or the mSupply email that was shared, or you can watch the video on YouTube that will be shared later on. And we'll all see you again in our next webinar on April 10th about tasking in Tupaya and Tamanu. Thank you so much, Korapa. See you around.